हाय एवरीवन, वेलकम बैक टू GM4T Academy। मैं हूं डॉक्टर राहुल गुप्ता और आज हम बात करेंगे उन डॉक्टर्स के बारे में जो स्टेथोस्कोप से नहीं, डेटा से डायग्नोसिस करते हैं। यस, वी आर टॉकिंग अबाउट द एपिडेमियोलॉजिस्ट्स। आपने सुना होगा डॉक्टर एक पेशेंट का इलाज करता है, पर एक एपिडेमियोलॉजिस्ट वो पूरी पॉपुलेशन का इलाज करता है, बिना इंजेक्शन के, बिना सर्जरी के। So, in this video, we will talk about who is an epidemiologist, what he does, and how he does what he does. An epidemiologist is not your typical doctor in a clinic. वो किसी एक पेशेंट के सिम्टम्स नहीं देखते, वो देखते हैं पैटर्न्स, वो ढूंढते हैं कनेक्शंस, वो पूछते हैं ये डिजीज ज्यादा किस एरिया में हो रही है, किस स्पेसिफिक एज ग्रुप में क्यों हो रही है, लास्ट मंथ या लास्ट ईयर से ज्यादा केसेस क्यों रिपोर्ट हो रहे हैं। इन सिंपल वर्ड्स, एपिडेमियोलॉजिस्ट इज अ पब्लिक हेल्थ डिटेक्टिव एंड देयर गोल इज सिंपल: prevent the next outbreak before it even begins. Let us understand their role not just by listening but by really walking in their shoes. Imagine a doctor checking a patient's vitals, blood pressure, pulse and temperature. अब वही काम एक epidemiologist करता है population के लिए. So, an epidemiologist monitors population's vitals through notifiable disease reports from hospitals, health surveys like national level surveys, district level surveys, disease registries like the NEETPG portal for tuberculosis. Let me explain that. Every time a new TB case is diagnosed anywhere, whether in a government hospital or a private clinic, that case is reported and updated in the NEETPG system, which is an online real-time database developed by the Government of India. So, a district TB officer can log in and see how many new TB cases were reported this month, which PHC is showing a sudden rise in TB cases, which patient has not completed the treatment, and this helps in identifying outbreak pockets, ensuring drug compliance and evaluating program effectiveness. So, surveillance is not passive, it is dynamic, continuous and actionable. Now let's say you are posted at a rural PHC, you receive an information from your health worker that about 10 cases of vomiting and diarrhea are being reported from a nearby village, all in the same day. By the next day, the count is 40. At this point, an epidemiologist is called in. Their job? Interview the patients, trace the timeline, identify the source, was it water, food or hand hygiene, collect samples, map the spread, and most importantly, interrupt transmission before it spreads to nearby villages. This is not guesswork, it's methodical, step by step and data driven. And you know what's beautiful? Most of this happens before lab results even come back. Because an epidemiologist doesn't wait. They act fast based on patterns, comparisons, and prior experience. Okay, next. Now let's say we want to understand whether cigarette or BD smoking causes cancer. Epidemiology will set up a case control study. Cases shall include lung cancer patients, while controls will be the people with similar characteristics but without cancer. Then they look back in time and ask, how many in each group use tobacco regularly? Or अगर tobacco use करने वाले mostly cancer group में हैं, that's the evidence of association. यही study Doll and Hill ने की थी 1950s में and it changed medicine forever. Epidemiologists help answer questions like, is fast food increasing diabetes prevalence in teenagers? Is pollution linked with rising asthma cases? Does a new vaccine really reduce diseases? They don't just report data, they generate it. No matter what the health program is, whether it is polio eradication, Janani Suraksha Yojana, Anemia Mukt Bharat, all of them are backed by epidemiological evidence. Epidemiologists advise the government which disease needs urgent attention, Which population is at the highest risk? What interventions would work best in our setting? They help prioritize, allocate, and execute. So, can you tell me why, according to National Program for NCDs, screening for different non-communicable diseases in India starts at the age of 30 years? Can you think the role of an epidemiologist here? Next, during COVID-19 pandemic, you heard terms like R0 value, test positivity rate, flattening the curve, second wave, third wave. ये सब एपिडेमियोलॉजिकल कॉन्सेप्ट्स हैं और इन्हें पब्लिक को समझाना भी एपिडेमियोलॉजिस्ट का काम है. They simplify complex data into messages that people can understand, policymakers can act on, and media can report. In a way, they become the voice of science during uncertainty. The real power of epidemiologists lies in how they approach problems. Their mindset is built around 3 habits. First is asking the right questions. Who is getting affected? Where is it happening? When did it start? Why is it spreading? They don't treat symptoms, they treat the systems. Second is comparing groups. They always want to compare. Smokers versus non-smokers, vaccinated versus unvaccinated, urban versus rural. Because it's through this comparison that risk factors emerge. And third is acting before it's too late. Epidemiologists are not just scientists. They are the first responders, analysts, communicators, and public health warriors. To summarize, epidemiologist works at the population level and not at the individual level. Their roles are surveillance, outbreak investigation, research, policy making, and communication. They think in terms of questions, comparisons, and actions. They help the healthcare system move from treatment to prevention. So, your task for today. कमेंट करके बताइए अगर आप एक एपिडेमियोलॉजिस्ट होते तो किस हेल्थ इशू पर काम करना चाहोगे और क्यों. Also, download the PDF notes from description, join our Telegram group for MCQs and flashcards, and subscribe to GM4T Academy for more videos. See you soon. तब तक के लिए stay curious and keep learning. Only on GM4T Academy.